Yat and welcome to 4 Directions of Wellness. I'm Roberta Diswood. In October of 2021, Northern Navajo Medical Center started a street medicine mobile health care program for those experiencing homelessness. The program is called Sih Hasin, and it is the first of its kind, serving rural communities on a reservation in the Indian Health Service. With us today is Dr. Asha Atwal, emergency physician who developed the Sih Hasin Street Medicine Program under the Northern Navajo Medical Center Health Promotion Disease Prevention Department. Thank you, Dr. Atwal, for being here with us today. Go ahead and tell us a little bit about yourself.
Hello, my name is Asha Atwal. I'm an emergency physician. I have worked here for almost 4 years in Shiprock. I started out 3 years working in the emergency department as the emergency chief, and have now moved over to health promotion disease prevention to start this program, which I'm very passionate about.
So, as we mentioned, it started in October of 2021. So can you tell us a little bit more about the Sih Hasin program?
So we started out, we being me and Dr. Chris Percy, envisioning a healthcare model that would deliver healthcare directly to patients that are experiencing homelessness where they're at. So the problem for people experiencing homelessness often is that they have difficulty coming to the hospital, coming to appointments, and are seen as high utilizers typically of the emergency department. So instead, we are bringing health services to them out on the street. So we offer acute, some chronic, more urgent care type of care. We give COVID shots, COVID testing, all kinds of wound care, and different types of things, almost anything that they ask for.
Okay, it looks really interesting to hear. So go ahead and tell us about some of the research that you did to develop this program, the street medicine program.
So initially I worked to work with community partners in the area in Shiprock and in Farmington, looking for gaps in delivering care and working with this population. So I went and met with tons of different people that are also very passionate about working with people that are experiencing homelessness, and worked with Dr. Percy here in health promotion disease prevention to try to come up with a plan. The program, however, at that stage we weren't sure what we were going to do. So what I did do was start looking around at different healthcare delivery programs that are successful, and the thing is most of them exist in an urban setting. So this is the first street medicine program that has come into a rural environment, the first to be on a reservation as well. And those kinds of things, because they didn't exist before, I had to kind of pick and choose from all of the different programs that I engaged with that are doing street medicine in an urban environment. So during that research process, I talked to people that did street medicine in Salt Lake, in Fort Worth, Los Angeles. There's a big program with USC, there's a UCLA program, there's UCSF, there's Santa Barbara. So all of these different programs all have different modes to deliver healthcare. Some of them are more volunteer-based, some of them are more student-based, some of them are, have a backbone starting in emergency medicine, some start in more primary care based. So there's a lot of differences between them, but I tried to synthesize what I felt would fit best for our patient population.
So when you first set up your program, how did you go about approaching people on the streets to get them to come to you guys?
So initially, kind of unanimously throughout all of the programs that I talked to, they all talked about offering something. That is very important to offer warm drinks or snacks or food or something to have people feel more comfortable, and so that is exactly what I did. I started out the program and luckily found a nice woman in the area who was able to make us food. So we do burritos or sandwiches every single street clinic. We start by handing that out, and then that kind of opens the conversation up to be able to ask other things. Are you in need of a jacket? Do you need a hat? And then we start talking about that, and then we start talking about whether they're sleeping outside, whether they have places to go. And then, from there you start learning about a wound that they had under their pant leg that they didn't want to show you at first. And so those kinds of conversations usually start with food.
And that seems to be a lot of how Native populations work.
I love that. It's also just how every human works, right? We all feel more comforted when there's food offered. So that was a big part, as I wanted to make sure that everybody we talked to felt comfortable talking to us and that we were able to offer them something.
So you mentioned some of the things like wound care and stuff. So what sort of services or things do you offer or can provide for them?
So I make sure that everything that we do offer will have a similar or same standard of care as it would have been offered in the hospital setting. I don't want to ever be doing something out there that is not going to be matched if that patient had come to the clinic or to the hospital. Mm-hmm. So a lot of things fall under that umbrella. Luckily for me, emergency medicine is a really great tool for me to have in my back pocket, and I'm able to do a lot of things. So out in the field, we have done abscess INDs. We've been able to give people antibiotics for that. I've seen a lot of patients that have gotten in fights and they've gotten in a scuffle and they have, a laceration from the night before. We've been able to help repair that. We've also just been able to clean out wounds where people wouldn't have access to adequate hygiene to do that. So there are quite a lot of things. And one of my favorites was toenail removal. Out in the field, and that one went smoothly. The patient had good anesthesia, and it was wonderful because we also have students and residents that come with us that get to have these learning experiences.
And so one of the things that I know here at Indian Health Service in the hospital that we've been pushing is, vaccinations and COVID. Is that something that's offered to them as well? Yeah,
so I spend a good amount of time actually researching all of the patients that we see regularly and keeping track of everybody's COVID shots, when the dates were, and trying to keep track of all of the boosters due, which it seems like they just keep growing. Now, everybody over 50 needs another booster, and in this patient population, it's extremely vulnerable. You definitely want to make sure you keep track as much as possible. During flu season, of course, we offered flu vaccines as well.
Well, it's really good to hear that you're offering those types of care for them. So thinking about as you're going forward, so what are the next steps for Sih Hasin?
So another project that Dr. Percy and I helped support here in the community was opening a shelter. Because shelter is healthcare for folks like out living rough, as they say. So people who are unfortunately unsheltered for parts of their lives have a lower life expectancy, and so providing shelter is a big deal. It prevents a lot of deaths from exposure, and also just disease processes from being able to take hold. So we were able to get a shelter open here in Shiprock for, from mid-March through last week. So it was just about a month open, and we were able to kind of get some research done, as to what needs to change for next year, with the idea that it's going to be open every winter. So at this point, we're hoping to open again in October 15th of next year, later this year, and then it'll be open until April 15th the following year. So that will be a seasonal shelter. So that's probably the next step. I'm also, continuing to look at expanding clinics in Farmington. So, since January, we've been going into Farmington as well, and there are a considerable amount of people experiencing homelessness there. And I've looked at the thoughts of expanding to have more than one group go out. At this point, there's just one team that goes out on Wednesdays, and we often see several patients, and then we feel like we could be going to more areas. So I think in future we're going to expand to having more teams go out on the same day.
That's good.
Yeah.
That's really good. So just before we end this show, I wanted to ask you, what has your experiences been so far, or things that you've learned during this clinic?
My favorite thing that I've learned so far is being able to be part of the community of people experiencing homelessness and understand how much they care for each other, how much community is involved in their relationships, and how much solace they get from each other. And being able to be there, and every time I pull up I get hugs, and people are super welcoming, and it's just I don't know, people say that we're doing a good thing, but they're doing a good thing just by being there, and for me to be able to experience that with them. I love working with them.
Mm-hmm. Well, I want to thank you for being here today and for sharing this information.
Great, thank you for having me.
This has been 4 Directions of Wellness, Hagone.